All right. Hello. Welcome to our first Conversations with HIDTA Communities webinar. I'm Laura Papard. I'm the Deputy Director for Treatment and Prevention at the Washington-Baltimore HIDTA. I'm also the Director of ADAPT. I'm joined today by Shelly Mowry, who is the Drug Demand Reduction Coordinator for the Arizona. As you can tell, we are sitting here in beautiful Phoenix, Arizona. I've enjoyed a lovely walk in this place, and we are so happy to be invited here to learn a little bit more about how Shelly and her HIDTA approaches prevention activities. I wanted to tell you a little bit more about the purpose of this series because it's a little different compared to the technical webinar series that we've been delivering. Before I do that, I'll tell you a little bit about ADAPT for those of you who are new to one of our webinars. Last year, on April 27th, we oriented the HIDTAs to ADAPT as a training and technical assistance provider for HIDTA prevention. And along those lines, we are tasked with helping to unite HIDTA prevention with a common language and to level us in some way with some fundamentals around substance use prevention. So we've had a lot of fun over the last year in getting to know some of you a little bit better and in delivering some of this individual TA or technical assistance. ADAPT is actually a division within the Center for Drug Policy and Enforcement at the University of Baltimore. And so the University of Baltimore is one of our fiduciaries, and I just wanted you to understand a little bit more about how ADAPT came to be. We're funded with discretionary funding through the National HIDTA Program Office. So what we've focused on over the last year is really a focus on the fundamentals of substance use prevention, and many of you attended a training called SAPST last July. Substance Abuse Prevention Skills Training. Actually, 90% of HIDTAs were represented in that training. That was a launch point for us. Following that training, we started a series called the Technical Webinar Series, and that launched this February. That series is more of a public-facing series, and this is why. 2/3 of Americans more than likely live in a HIDTA community. And so we wanted to support all of you, our HIDTA family, with developing concepts within substance use prevention, but also all of the community partners that you work with in your HIDTA community. So we intentionally made that one public facing. Many of you have attended the program planning, evaluation, risk factors, protective factors. We're breaking them all down and we have several more to come. And Patty, our assistant director, will tell you a little bit more about that. But this series, it's a little bit different. And I'm very excited to invite just you, HIDTA representatives, HIDTA drug intelligence officers, HIDTA public health analysts in partnership with the CDC to come together for some intimate time today. And let's dive inside the mind of this dynamic Shelly Mowry, learn a little bit more about how she and her HIDTA approach prevention within their communities. And they cover a lot of Arizona. Before we do that, I wanted to go ahead and turn this over to Patty for some necessary housekeeping items. Patty?
Hello, everyone, and thank you for joining today. We're going to make an assumption that by now most folks know how to use Zoom and are pretty adept at that, but I did want to share with you a little bit about how you can best interact and engage today, because we really want to have folks engage in conversation throughout. So the presenters will have a couple of stopping points for Q&A. Feel free to go ahead and send in via the chat feature any questions as they're coming up for you. We'll synthesize those and present those to the speakers at these stopping points. In addition, you'll be able to utilize your raise hand feature, which is going to be found in the little reactions tab at the bottom of your screen. So from there, you can raise your hand when you have a question. Again, we're going to consolidate the questions during these Q&A time points, and then we'll have plenty of time towards the end for open Q&A as well, and discussion for any comments and questions that you all may have. Also, as Laura indicated, I want to share with you a couple of our upcoming events. You all will receive this in the chat box. I'll be putting in some different resources throughout. And just to orient you to that, we have 3 of our technical webinars that have been scheduled for June. One is on persuasive messaging. It's the second part of a two-part webinar series on persuasive messaging. And this one is really a bonus webinar we didn't initially plan for, but there was an overwhelming interest by the audience to learn more about how to use this particular model that was presented called the Equip to help in constructing persuasive prevention messaging. So that is coming up on June 3rd. On June 15th, we have a value analysis webinar, which is really going to focus on the value of prevention and utilizing a cost-benefit analysis in supporting sort of prevention value analysis and determination. And then that's June 15th. June 23rd, we have a webinar on appraising evidence, which is really going to be presented by some of our CDC colleagues focusing on how to best understand emerging, promising, and best prevention practices. So save the dates. I'll be dropping that information into the chat box here momentarily. Back to you, Laura.
Thank you, Patty. So I wanted to move us into an opportunity here today. You will not find a PowerPoint in this conversation. We truly have designed it as a conversation. Shelley and I have generated some questions that we consider essential, would you say, to cover for your HIDTA's approach to prevention. So we definitely need to get through those. That said, while those questions are designed to do more of a deeper dive into the way Shelley approaches prevention, we've built in 3 specific stops and pauses so that you can engage with Shelley personally. Because again, the primary goal of this particular series is to promote engagement among all of us within HIDTA prevention. And that includes our public health analysts and our DIOs. Very important piece of that. So I'd like to introduce Shelley now. I've had an opportunity to get to know her a little bit better. She sits on the HIDTA Prevention Committee. She also sits on the ADAPT Advisory Council. She's worked for the Arizona HIDTA for 7 years in this particular role, and she also wears some other impressive hats for this particular HIDTA. But Shelley's been in the realm of substance use prevention for 20 years. And prior to that, she had a beautiful career in media. She has a bachelor's in journalism from the University of Missouri. And I've just really enjoyed getting to learn a little bit more about her. But now I understand why you're so strong in this field, because she carries forward a lot of the skill set that is from her former career into substance use prevention. So with that, Shelley, I'm going to ask you, how did you even get into this field from media?
Well, it's a great question. And first, I just want to thank you and welcome to Arizona. We're so happy to have you here and, making the flight out. And we're actually happy to be your, first inaugural conversation. So thank you for including us in that. And when you asked me, so how did I get, here? It's a journey that began, long ago. I will tell you that, like many on this webinar today, a lot of us are people who desire a profession to serve. And so as a child, even in high school, I always looked for opportunities to serve. And so going away to college, I really didn't know what I wanted to do. And, talking with some people and talking with my parents, at the University of Missouri, there's a great journalism school. And so I didn't know if I was going to get in. It's pretty hard to get in that school. And then I didn't even know if I would make it once. I didn't even know how I was going to pay for it. But I kind of set my sight on that. And I thought that at the time, again, remember, I graduated a long, long time ago. Journalism was really important to me. And I thought, how can I can serve the community by letting people know what's happening in their communities. And so I went to journalism school, and I passed under an arch every day that said, "We shall be the bearers of truth." And that meant something to me, because that's the reason why I approached that field, is because, in spreading the truth and letting people know what was happening to help people avert danger if there was a storm or something like that coming, that was always sort of part of what was in me. So I got accepted into journalism school. I made it. And then I didn't want to do on camera. So I was more of a behind the scenes producer. So a producer is a person that actually puts the stories together. They put the lead together, and then they handle all the breaking news. They're talking in the anchor's ear. So all of that goes hand in hand with the producer role. And so I was a producer, and I worked at several stations. I went to Tallahassee, Fort Myers, Denver, ended up here in Phoenix. And so I did that for many years. And I was the executive producer here in Phoenix for about 7 years. And at the time I had gotten married. And so the news business is a 24/7 business. Anytime there's something that happens, you're down at the station or you're here, you're there. And so an opportunity came to me. And I had a source at the Maricopa County Attorney's Office who would call me from time to time and, give me a story that no one else had. So I love that. And so he said, hey, we have this opportunity here to do, we want to do a media campaign and we want to partner with a Partnership for a Drug-Free America. And so at the time I'm like, well, geez, this is right my wheelhouse. It's a media component. It has my media background. It has an issue that I was very passionate about. Remember, that need to serve has always been in me. And I have not only immediate family members who have struggled with substance use disorders, but also extended family. So my whole family tree is full of substance use disorder and also mental health challenges. So I said, yes, I'm very interested in this. And so I went and I interviewed and I got the job and left, a television news career, and people thought I was crazy, but you just follow what you love. And that's what I've always done. So I ended up at the county attorney's office and started Drug-Free AZ. And I have to say that I want to thank the DEA. They took me under their wings at the time back then and really showed me kind of the ropes. And because here I was coming from a media background. I had done stories with the DEA and about the DEA, but really had never known sort of the inner workings and what was happening. So that was great. And so I loved that job. And I went to go work for the Partnership for a Drug-Free America, the Arizona affiliate, full time. And then I came to work here at HIDTA. And I've just loved it ever since.
We sure are fortunate to have you.
Thank you.
And you and I talked a little bit yesterday, and I think it's valuable for the participants here to really hear. You felt like that training with the DEA really prepared you fundamentally for some of the things and the work that you're doing here at HIDTA.
Absolutely. I mean, I had sort of an outsider's opinion and thoughts and views on sort of what was happening and what I thought was occurring in the DEA, even from a demand reduction standpoint at that time. I had a really good mentor there, and she helped me along and showed me the ropes. And I'll tell you, I mean, Laura, even sort of taking a look at where prevention is now in 2021 compared to where it was in 2020, we've come a long way. I mean, the prevention science and everything that has evolved over these years is incredible. And so, but I credit them with those first few months, that kind of instilling in me that knowledge. And I appreciated that because they trusted me, and that was important. And so they trusted me, and we had a great relationship. We still do.
Yeah. And they're a huge collaborative partner with us here at ADAPT as well.
Right.
We share a lot of materials and are thankful to have them as a partner.
Yeah.
So how then is your work with HIDTA over the last 7 years different from your work as a reporter, and how is it a little similar?
Well, the work here, let's see, that's a good question. So in terms of looking at media, I mean, you're trying to cover, the story from a bigger picture. And I guess here, the reason why the HIDTA job was so wonderful to me was that from a prevention perspective, right, we're always having to wait to see what happens, the trends, the hospital data lags, overdose data lags, youth substance use lags. And so really what excited me about this job was that in terms of working at HIDTA, law enforcement always sees trends before, a lot of those other sectors. So coming here and putting prevention with HIDTA and having those HIDTA resources was that beautiful match that really helped me guide prevention here for us.
Sure. And what is it that makes HIDTA unique and some of the unique resources you have access to here, right, that you use to inform the prevention activities that you coordinate and plan and disseminate throughout?
I was really excited. So whenever I came to HIDTA and I found out about the threat assessment and all the data that's gathered and everything that's put together in threat assessment, I'm like, wow, this is like a gold mine of data that can be used to help us drive prevention efforts. So, I mean, I was just reading and reading through there. And then the other piece that we have here at our HIDTA is that the way that our state is broken down is that we have initiative commanders. So our initiative commanders come together regularly and we can hear what's going on in different parts of the state. So not only do we have the threat, but then we actually hear what's going on like right now in the community and in the area that they serve. And so that is really helpful for me. So if there are HIDTA directors, listening and you have these initiative commander meetings, I would suggest really incorporating prevention into those meetings. I mean, I always knew that what I was hearing was law enforcement sensitive and never shared that information. But I always used it as sort of a guide to help me in prevention work and to kind of help guide other efforts where, people were going. So, I'd always say, be as inclusive as you can with prevention in areas where you can, so that your preventionists can be on top of things when, trends are happening.
So talk us through that a little bit more. You said you always use it as a guide.
Mm-hmm.
Can you give us an example? How would you use information from the threat assessment and actually transform it into an actionable item in a prevention activity?
Right. So should I give the most recent example?
Let's hold on that one.
Okay. All right. So for example, methamphetamine has been a number one threat here in Arizona. And so knowing what was occurring with methamphetamine and the evolving sort of landscape of methamphetamine, we put together a toolkit for communities around methamphetamine. For prescription drugs, whenever there was, sort of the opioid epidemic was just beginning and it was more prescription pills, we did a lot around, we used the threat assessment to help guide that, what was happening in terms of street purchases versus doctor shopping and those types of things. And so we actually had a model then, a prescription drug misuse and abuse initiative model, where we created, prevention materials, treatment materials. And that was a really great project, because one of the things that law enforcement at the time, this is long ago again, remember, so we're using the threat assessment to help us drive this issue with prescription pills, was that the proper disposal, because kids were getting access to them out of the medicine cabinet. And I will tell you, the wonderful thing about law enforcement is that they very rarely have ever told me no. When we asked them to put prescription drug drop boxes in their lobbies, okay, they were just so inviting, and law enforcement see the devastation that drugs have in their communities. So we partnered with a lot to get, lock boxes, and not lock boxes, but the drop boxes in, police stations and in substations and that type of thing. So they've been a great partner. So I guess that's how, and then we do a training here called Stronger Together. We do that once a year. And then we do our Arizona Drug Summit. So I basically just take a look at the threat. Here's what we have. And then I tailor all of that training around that threat assessment, because if that's the greatest threat, and from all of our initiatives, our preventionists need to know, our public health folks, our public safety folks, and our preventionists need to know, what's occurring, so they can address the issue at hand rather than addressing something that may not be an issue.
So you just very beautifully described a HIDTA-driven response, a HIDTA-led response. So based on the information that you are viewing through the threat assessment, and albeit it's not a public threat assessment, so it's not for public consumption. Right. The purpose of this webinar series that we think is really neat, right? And you and I've talked about this a lot, is that it's an opportunity to truly articulate HIDTA-driven responses and what role we can play, right, within the substance use prevention field, and guiding that in some way, shape, or form for our communities in need. Can you talk? I know we're going to get to a really hot example later on, and we'll have a deliverable for the audience related to that.
But can I jump in here for one second?
Yeah, of course.
Because here's one thing that I think it's really important. A HIDTA-led initiatives, we always have partners, and that I think is, again, I have a lot of I've been here for a long time in the community. And so I know several different people, but in order, it's great that we're sort of leading, and we can rally the troops. So we can get people, and, we can get our health department, and we can bring everybody together. And that really is kind of our job, because we see these threats early, and then we can gather those necessary hands around the table to help us, make a difference. And so that's the one thing, is that we really strive to have collaboration, partnerships, again, building that trust, credibility, loyalty with all of those partners around the table with HIDTA, so that when there is a new threat, that, you know what, all we have to do is bring those people around the table again from public health, public safety, sit down and say, this is what our threat is showing us. Now, how are we going to respond?
Beautifully said. Yeah. HIDTA really is nothing without its community partners, right? Like it takes a village. If you were to give some guidance for everyone on the webinar today, considering the threat assessment isn't public, but there could be some type of public version made available, right? Can you talk them through that? What would be the first 2 to 3 steps that they could take to actively use the threat assessment to inform some of their prevention activities?
So, on the sort of making that public, so that we're taking the thread and making it sort of a non-law enforcement sensitive document.
You had mentioned that your HIDTA had developed a
Right. Okay.
Yeah. Can you talk down that line a little bit?
Yeah, absolutely. So, so as Laura was saying, what we do in understanding that the threat is law enforcement sensitive, what we do, because we get a number of requests from all sorts of different agencies, governmental. We get American Indian tribes that ask for presentations. We get community groups. We get drug-free community coalitions, that request information. And the one thing is that, we don't want to hoard that, because, sharing it and letting other people know what's happening, then they can look within their own communities and say, okay, boy, we really need to be addressing this. And so I think some of the first steps is to sit down and to talk with your threat assessment group about how can we make the top, whatever, if you want to, let's say, for the next 2 months or 3 months, we're just going to focus on the top 3 threats, because you may have 5 or 6 or 10 threats, in your community. You say, okay, we're going to focus on the top 3, and then sit down with your threat assessment group to say, okay, how can we make this so that it can be non-law enforcement sensitive? So for instance, what we do is when we sit down to do that, we have a PowerPoint presentation that talks a little bit about the HIDTA, because one of the things that we find, even still now doing presentations in the community, is that people are still learning about HIDTA too. So we set it up with a little bit about what HIDTA is and what HIDTA does. And then you go into, you can go into what you do in the threat. So for instance, our number 1 threat this year is going to be fentanyl. So we can incorporate data in terms of the large number of pills seized. We can go into the price, of the fentanyl, the cost. And so we can talk about, our second threat of meth, and we can talk again about seizures, and we can talk about what's occurring in Arizona, at the border and those sorts of things. So there are ways to make your threat non-law enforcement sensitive that's able to be shared, in the public. So I always tell people, don't put anything in your public facing presentation that you would not want to see on the cover of your local newspaper or on a headline news, because, that's out there and that can be shared. It can be emailed. People take screenshots all the time, or photographs, but there is a lot of information that can be shared that's non-law. We never want to mess up a case or, get in between something that's occurring, but there is a lot of information that can be shared that's useful to other groups working in that same space.
And like you said earlier, it can be a form of early awareness,
right,
around some of the trends that may be occurring.
Yeah.
At this point, we're going to pause. We've covered a lot of information so far. We're going to pause, and I'm going to turn it over to Patty. Patty, do we have any Q&A? We'd love to start the engagement process now.
Ladies, there are no questions coming through the chat just yet. So folks, feel free to raise your hand if you've got questions that you would like to ask of the presenters at this point.
Okay.
Not seeing any coming up just yet.
Okay, we're going to keep going then. So Shelley, one of the biggest examples of that really struck me when you described it only a few months ago that was occurring in your particular HIDTA region was when 14 and younger children died of overdose over the course of a year. And there was some relation to counterfeit pills, I think, established in that scenario.
Mm-hmm.
And that was an emerging threat that required an early response that you all took a hold of, right? Can you talk us through, describe a little bit about what was happening at the time and
Right.
how you thought through it, how you approached your response to it?
Right. Yeah. So it was an emerging threat, and it's urgent. I mean, we're right now in the middle of a fentanyl emergency, if you will, here in Arizona right now. But kind of backing up to how we got here, you know, we were hearing over the past year and a half stories about these counterfeit pills laced with fentanyl, most of them M30s, some Xanax. And so we were hearing from different initiatives talk about, you know, these pills and what they were seizing. And then we just started hearing more and more about overdoses from these counterfeit pills laced with fentanyl. And so again, we didn't have any data on the Department of Health Services side, but we were seeing what was happening in terms of seizures, and we were hearing from our initiative commanders that were responding to overdoses, and a lot of the overdoses had these counterfeit pills. And you know, back in just even a couple of years ago, even 3 years ago, it really wasn't on the radar. And then all of a sudden, boom, there's this explosion of fentanyl and these counterfeit pills laced with fentanyl. It was showing up in our methamphetamine here. It was showing up in our cocaine supply here. It was showing up in our hair, in all of our stuff, almost every drug. It was fentanyl showing up. And then we had this huge explosion of pills. So much so that we had one person say, it's raining counterfeit pills laced with fentanyl in Arizona. I mean, it was so bad. And so at the time I was like, oh my gosh, this is the coming storm, right? With fentanyl. And then, so I'm involved with a number of community coalitions. We have a group that meets. And so we were getting these anecdotal stories of teenagers dying in their sleep and overdosing and dying. And, you know, children, like you said, under the age of 14. In my 20 years of working in prevention, never in my career have I ever seen children 14 and under, 14 in 1 year, dying. And so we were getting all these anecdotal reports. And so I'm talking to everyone. I'm hearing the initiative commanders, talking with our threat unit. You know, I'm hearing from now a little bit from on the health department side, Department of Health side. And I'm like, okay, we have a real issue here going on. And so we need to start finding out, getting some data and start taking a look at that. And so, you know, it kept occurring and occurring. So we started putting some things together. And so I was talking with this gal and I said, and the other thing that popped up all of a sudden was that these teenagers were getting their counterfeit pills laced with fentanyl through Snapchat and through social media apps and through texting. And so that was a huge concern. And then we were learning about kids that were too afraid to call for police. So they were just leaving their friends to overdose and die. So all of these things were occurring at the same time. And then, you know, our threat assessment comes out and we're like, oh my gosh, fentanyl's number one. And so we immediately got together with some of our prevention coalition folks, our initiative commanders. They got together a lot of different people. And
did you coordinate that, or
yes,
how did that happen?
So I did. So
Okay.
I reached out to another coalition leader here that has one of the largest drug-free community coalitions and substance use prevention coalitions in the state. And she kind of helps run that group of 30. So I reached out to her. I reached out to our initiative commanders. I talked to them about what they were seeing. And I said, okay, we've got to do something, because historically in Arizona, and I have no idea why, because it's so hot here, but historically June, July, and August are our highest months for overdose. In August of last year, we had 506 opioid overdoses within a 30-day period. That's a lot. So when I was talking to the initiative commanders and all of this was occurring, this was probably just about last summer, all of this was starting to take place. And so we're like, we've got to do something. We have to put something together. We have to bring everyone together and let's see what we can do here. And so we started working on it, and we have a great partnership with our Arizona National Guard. And so we got some people together, and so they were working on that Snapchat piece. And then I was working on the fentanyl piece and the counterfeit pill piece, gathering enough information to try to decide what are we going to make this prevention out? What are we going to make this look like? And then it started getting legs. And so different people in different sectors started hearing about these efforts that we were doing. And so there was some interest at the state in terms of being able to fund an initiative through the state opioid response grant. And so from that, we started working on the official fentanyl and counterfeit pill toolkit. But that's kind of what happened. I mean, this whole series of events started about 1 year ago from right now.
You mentioned that you have a group that you regularly meet with representatives from across your region.
Right.
Can you talk a little bit more about that group and how you got plugged in, how frequently it meets?
Sure. Yeah. So it's called the Substance Abuse Prevention Coalition Leaders of Arizona.
Okay.
And so it's just a networking group. So we all get together from all different parts of the state. We hear about what's going on in their communities. We hear what needs they have. We also hear, what they're up against, like what are some challenges that they're seeing. For instance, there was last year, the school resource officer from one of our southern counties said their school resource officer was responding to overdoses in the classroom every single month. And so they needed to make sure there was naloxone in the nurse's station, in order to be able to save these kids. So we get together quarterly. Now it's been virtually for the past, year or so. And we formed a really good group of coalitions from across the state. And now we're able to mobilize those 30 coalitions, which we've never been able to do before. This is a first ever effort attempted like this in the state of Arizona.
It sounds very much like an information exchange as well.
It is.
You were hearing about, from your school resource officers, events that were occurring in schools. Something a little bit different, Washington, Baltimore, HIDTA region, we cover a variety of states, right? So we're not just in one, right? And I know that there are other participants on this webinar who are in a similar situation. So they might not have a state-driven or state level association like that, the coalition leaders. What would be your advice to getting plugged in and maybe helping to create, if one doesn't exist, some type of information exchange for their region, their different touch points that they cover?
I think one of the great places to start is with the drug-free community coalitions. And so one idea that I always had here is that, let's hold a meet the director session where the drug-free community coalitions all come together and there's a chance to meet the director. And then at that point, then you can provide that non-law enforcement sensitive threat assessment. You can talk a little bit about HIDTA. You can show them around your HIDTA. You can show them the training center if you would like. Some don't, or you can hold it outside of HIDTA. If you have if your building is in a sensitive area and you don't like a lot of, traffic from outside, you can host it, at a neutral location. But host a meet the director event with your drug-free community coalitions, and then, just bringing people together quarterly, because a lot of times they're not talking to each other. And I think that what you find is that they're just looking for someone to lead that. That's really what they need. They need someone to step up to say, you know what, I'm going to, or hide in this HIDTA role, we're going to bring our community coalitions together every quarter, and we're just going to talk about what your needs are. What are you seeing? What are you doing? What are your challenges, successes, and how can we help? And just bringing that together and then just building that relationship, because again, I can't stress enough the importance of relationship, because when you have an urgent threat, and I'm telling you, Laura, if counterfeit pills laced with fentanyl aren't killing your kids, they're going to be, because they are flooding into Arizona and being distributed out to the rest of the United States. And so once you have that camaraderie, once you have those relationships, and once you have that trust with those coalitions, it's a beautiful thing, because working together like that, I mean, I'll do anything for community coalitions. I always said the newsroom was a 24/7 job. Well, so is this one. Because if a coalition calls me and they said, Shelly, we lost 3 kids over the weekend, we need to do a town hall next week, can you help us? Of course I will. So that's the type of relationships in developing that you can respond to those urgent needs, because they're going to come along. Many of you are already facing them right now and are just stuck. And then people are like, well, it's too hard. Well, it is hard, but if you don't do it, the consequences are much worse.
Absolutely. What a really neat idea that is to hold a Meet the Director
Uh-huh.
event. Tom, if you're watching right now, I think we should do that at Washington, Baltimore, HIDTA. I think that's a really neat idea.
Mhm.
For those of you who were not able to attend our Drug Free Coalition webinar, we did host a webinar specifically for you guys. Patty, I think that was back in March, maybe beginning of April. It's available on our Adapt YouTube channel, and you'll get that information at the end of this webinar if you haven't already subscribed. But that would be kind of a neat webinar to revisit or to watch for the first time, because it does cover some of the common denominators between drug-free coalitions, HIDTAs, ORS even. We had CDC represented there with ORS, but also it really describes some initial ways of engagement with the DFCs as well. And I can tell you after that webinar, even in our Washington, Baltimore, HIDTA region, we had several reach out to us, and we invited them very quickly to what we call our prevention committee, but it's transforming into more of an information exchange.
Nice.
Like it sounds like what you guys have done here. Shelley, before we pause a second time to see if there are any questions at this point, if you had to just bullet point the way you thought through the alarming news and this threat that was described for you by multiple, it sounds like it was informed by multiple data sources, right?
Right.
Reports coming in from this group, but then also the threat assessment.
Right.
If you had to just bullet point the top 3 things, of how you thought through that, what would that be?
And I guess this is kind of going back to where that journalism career kind of plays in, because I just became sort of a reporter. I went and I found everything that I could and talked to as many people as I could. So I think the first step, right, is to get all of the information, get as much information as I could from the people who are actually seeing what's occurring. So whether that I was talking to a doctor, a pediatrician, an initiative commander, a public health analyst, a drug intelligence officer, a member of the National Guard, whoever I was getting as much information as I could, because one of the things I wanted to do is I don't want to panic someone about an issue if there's, that's something I'm really adamant about, is that we need to make sure there is significant evidence to support our response, right? Because if you start blowing things out of proportion, then you lose trust and credibility, right? So if you're gathering all the troops and you're saying, well, geez, we have this emerging threat, but it's not really occurring, you can lose a lot of credibility and trust, and we don't want to do that. So one of the things I always, I have this theory, right, that we have a large number of kids overdosing and dying from counterfeit pills laced with fentanyl. That's the theory, right? That I'm working on. So I'm trying to get data and information to help support, or if that's not the case, then, okay, well, maybe it's a different age group, or I'm moving on to something else. So whatever I find out, there's no negative. I'm not trying to find information just to support my theory here. I'm trying to figure out what's going on from every angle that I can. So first, it's information gathering.
Okay.
So going to all sorts of different sources. And then the second step would be then to synthesize all of that, right? All that information. And then third is to share it so that I can share it. First, I share it with a small group to say, okay, this is what I have. And it's experts in the field, and say, okay, what can we do with this? And so then you share the information, and we're like, okay, let's come up with a plan. And that's sort of the idea. And then develop a plan after that. But sort of big picture, it's gather the information, share the information with a small group, and coming up with a plan.
So gather, synthesize, share.
Right.
All right. And then we're going to move on to what happens after you share the information and how you actually develop the response. We're going to pause right now. Patty, throwing it back at you. Any questions that have come in for Shelley at this time?
Yes, there are a few. So as we start with these questions, if folks have additional questions, please enter them into the chat. The first question, which Shelley, you did address this somewhat, was whether when you started, you reached out to any of the coalitions first before doing any new programming. This particular attendee is mentioning that they're in the process of building a worksheet that will contain at least one coalition from every county in the state, so that can be disseminated and shared as a way of sort of serving as a directory of sorts. seeing that this is something that San Diego had done, have you done something of this nature?
So, so the question is, did I reach out to coalitions first?
It's a two-part, right? So did you reach out to coalitions first, and then have you done any work to help support, I sounds like creating some type of a directory of sorts of the coalitions to be sort of disseminated more broadly across the state?
Okay. Yeah. Great question. So on the second part of the question, yes. So the Substance Abuse Prevention, the Coalition Leaders of Arizona, has its own website. So you can see all of the different coalitions that are involved all across the state on that website. People can find their local coalition in their community. And what we find, audience, I was going to say Patty because she asked the question, but what I find is that there is quite a lot of turnover, and we have so many community coalitions that what we do is we keep an online repository of those coalitions and their coalition leaders so that we can go in and update it regularly. Because by the time we get a one sheet printed, somebody has already moved on and accepted another job. So we keep a virtual version of that, an online version. And then on the first question, did I reach out to drug-free community coalitions first? It's a good question. So when I was in that first stage of gathering all of that information, absolutely. Because I'll tell you why. The community coalitions touch so many people in their community. So, the grieving mom hears about a coalition, or she knows a coalition member, and she tells him, she said, I just lost my son. And hey, can I come to your coalition meeting? Because I'd like to share my story. And so, yes, I absolutely did. Because when I reached out and I talked to those community coalitions, they know so well. I mean, just like law enforcement does on the law enforcement side, the drug-free community coalitions, they know their communities and they know the struggles that people are going through. And so, yes, I did. They were a big part of that information gathering and also the synthesizing and then in the plan. So I have coalition input at every single step that I do.
Do you want to, just to piggyback on that, do you want to share for those who aren't as familiar with the composition of drug-free coalitions, right, within those communities?
Right.
Share why they might have access to all that information with the sectors.
Yeah, it's a great point. So all drug-free community coalitions and many others that aren't funded through drug-free communities, there are many that are funded through other grants. But I think what they find is that, again, gold standard for a coalition is to have, 12 different sectors. Those include business, schools, volunteer groups. They include a youth. They include faith-based sector. They include youth serving organizations, treatment organizations. So you can see parents. So you can see that with all of those people around the table, that they really, in a community, they touch a lot of other areas. And so, for instance, the Chamber of Commerce in one community brought up the fact that people were overdosing in bathrooms. And so, we didn't know. And so, that was occurring a lot more than anyone thought. And so they wanted posters to put on the back of a bathroom stall about naloxone and Good Samaritan law. So you just never know. And that's why it's always important, again, to reach out with those coalitions, to have that relationship, because they also see things and hear from people that are in the middle of substance use disorders to help us with primary prevention. I'm a primary prevention gal, so that's
primary prevention queen. You have been deemed. Absolutely. For those of you who aren't familiar with the traditional 3 levels of prevention, primary prevention really focuses on preventing onset of use. And, target population is obviously younger, but not necessarily. Young adults are captured in there in many ways as well. Secondary is identifying risky levels of use and risk stratifying it and appropriately intervening with leveled interventions. Then tertiary prevention has a lot to do with harm reduction, preventing further harm, mitigating that harm for those with established substance use disorders. So you really focus and have been very clear about that with us, that, primary prevention is your heart and soul. You live in that world.
Thanks.
We do have another question that has come up. So Shelley, you previously spoke about going out and doing presentations with various community partners. One of the groups that you identified is working with some Native American tribes. The question is, how were you able to get that established? What strategies did you use to foster that engagement? There's some additional comments here about there are several small tribes in this person's region that they feel should be a part of prevention. And I'm inferring a little bit that perhaps they're not quite at the table just yet.
Yeah, sure. Yeah. So in Arizona, we have a number of American Indian tribes all across our state, that largest being the Navajo Nation. And I will tell you, for me, what it came back down to were relationships. So we have a large group here called, and in your state, you may have something similar. So we have the Intertribal Council of Arizona, and that's an organization that represents many of the tribes across the state of Arizona. And so as an example, when we created a toolkit on preventing prescription drug misuse and abuse in Indian country, we went and we met with the Intertribal Council of Arizona, and they helped us all along. They guided the process. It was a tool for their community, and I basically was an attendee and helped put the materials together. So that was one way, and that was a 2-year process. So we again developed relationships, we developed trust. And so they got to know me. I wasn't going anywhere. I promised I would be there to the end of the project. And so we worked on that together. And then we have another group here in Arizona called the Indian Country Intelligence Network. And so I would go to those meetings and we would talk, and that's law enforcement that works in Indian country in Arizona. And so we would get together and we would meet and talk about problems and issues. And then I would share with them, and then they would share back with me different things that they were looking for as well. Always letting them guide, the conversations. We actually are very fortunate here. I think we have one, I don't know if there are others, but we have a very good, it's called Native, which is our task force down on the border. It's the Tohono O'odham Nation, and they have been awarded numerous awards for their work down there. And I'll tell you with that, so our initiative commander there is a guy named Chief Rodney Irby, and they started seeing methamphetamine a couple of years ago down in their community. And so he, as the initiative commander, already had the relationships within his community. So he took that methamphetamine prevention toolkit and utilized it in his community. And the data, I don't know it off the top of my head, but it was phenomenal. I mean, and just again, it takes a couple of years for, once you start a prevention program to start seeing some impact and results. But I mean, there were all sorts of really positive outcomes in terms of domestic violence and lower substance use. I mean, it was really impactful. And so with the Navajo Nation, we put in a request, and we didn't know if we were going to be able to get the Navajo Nation president to do a video with us. And so we went to the sheriff in the county that is part of the Navajo Nation, who had a really good relationship with the Navajo Nation president. And so we asked for an introduction. And so I guess a lot of my work I've just found over the years that's really what has helped me, is just establishing those relationships, meeting people where they are. And I drove up on Easter Sunday to shoot the interview, and that was fine because that's the time frame they gave me, and I was going, and I wasn't going to let them down. And so we did that, and so I think that's how I would suggest in terms of working with them. And if they're not ready, they're just not ready. Sometimes just little steps in terms of just an introduction to say hi, and I'm here to help if there's something that I can do, or just being there and seeing your face and just knowing that you're there can also lead to other conversations and really developing that relationship to leads to something else.
Thank you. And
don't get discouraged.
As a follow-up to that, is that this speaker is coming from New Mexico. So have you happened to have heard of any such councils in New Mexico that you're aware of, or that might maybe cross the states in that region?
I'm sorry.
Are you aware of any similar councils in New Mexico?
Oh, I'm sorry. I don't know if there are I would bet there would be. I'm not familiar with them if there are. So I'm sorry. I don't know.
Okay.
ADAPT is happy to help you do some research on that. If you'd like, if this is Cheryl or Justine by chance, we can easily get you that information. But we're happy to do a quick quick dive into what's out there if you're having a hard time finding something.
It is Cheryl. She says thank you.
Okay.
Also, a question coming in from Tom. So, Shelley, you mentioned earlier using threat assessment and various HIDTA data. The question was, are you specifically looking at PMP drug seizure data to help identify the threat? He was pointing out that Arizona HIDTA has seized nearly 1 million fentanyl pills just so far this year, whereas last year all HIDTAs seized about 4 billion fentanyl pills. So I guess the question was, is the PMP drug seizure data part of what you are using in order
Absolutely.
to inform your threats?
Yes, absolutely.
Okay, thank you. One last question for the time being, it looks like, and this is a topic we haven't yet touched on, but how are you working, if at all, on the various community trends that are encouraging drug legalization? In other words, are there any sort of prevention-based strategies, communications, anything that are deployed currently in light of growing community trends toward drug legalization?
Right. So in general, I'm not aware of. So what I'll just tell you what happened here in Arizona. So in our last election, it was 2020, right? So, yeah, so 2020, marijuana was legalized here. There was we had sort of we were working to try to defeat legalization. It did pass. And so there are efforts to try to regulate it now. And that's where we are here in Arizona with legalization of marijuana. Now, legalization of all other drugs, I don't know in terms of, I don't really know how to answer the question too well, or what.
Maybe if something was to, it sounds like marijuana is now in the
Right.
regulation stage, right? But
Right.
for others, and even in the regulation stage, is there
Right.
anything that you're doing to advocate one way or another? Any agencies you're working with specifically to help develop activities? How do you think through that?
Well,
that's a good question for all of us.
It is a good question. And, I think that right now, marijuana legalization was a threat, right? And actually marijuana last year moved up in our threat because we saw so many vaping cartridges, THC vaping cartridges. I mean, we were seizing a lot of those. And so that was part of our threat. And so right now we don't feel the challenge, I guess, of this big push in our state to legalize all drugs like mushrooms or personal amounts of methamphetamine. Our laws aren't structured that way right now. And so
you did have an interesting strategy you described to me yesterday around what we can do is we can characterize impact.
The
impact that it's having. Could you talk a little bit about that?
Yeah.
We could do that.
Yeah, for sure. So I think that, in terms on the marijuana side, one of the things that in a lot of legalized states, you see the marijuana impact reports. So in states where substances are legal, you can that's actually a great idea, is that, if you're living in a state where personal amounts, possession of marijuana or methamphetamine is allowed, or heroin or any substance, in terms of just taking a look at the impact, whether it's the impact on the healthcare system, whether it's the impact on foster care, whether it's the impact on your child protective services, whether it's the impact on school dropout rates, whatever that is taking a look at, since if legalization has occurred in your community, taking a look at the impact on all of those societal costs. Because in my opinion, and I know we're a small group here, so is that people don't look at the unintended consequences of legalizing substances. And because I don't know, I'm going off the cuff here. Here I go. But, if you're a child living with someone with a substance use disorder, or aunt or uncle, or if you've lived in that situation, there are devastating consequences of it. And so, so I just say, you just look at the impact. It's a really good idea.
Put together the facts. Sometimes the best way we can help is just to tell the story.
Yeah, just to tell the story in an unbiased way, right? Because honestly, we really have to make sure that we're doing that. Everyone in our HIDTA community, our public health analysts, our DIOs, everybody, we have to be talking about this, not out there making assumptions. We're just telling the story in a factual way, because we always want to maintain our credibility. And sorry, I think maybe I gave a personal opinion there. So sorry about that.
Any more questions, Patty?
No further questions at this time.
Right.
Okay, well, now we get to the good stuff. This has all been really good up to this point, but we've been very excited to share this with you. This is an actual deliverable that Shelley's been working on for the last 7 months. And ADAPT is thinking through, if we were to add a technical assistance domain called early response. Currently, we have implementation, evaluation, identifying best practices, financial consultation, sustainability. These are training, our typical domains, but we've been thinking through an early response domain. And you did it in a very short time frame. You talked about the problem, right? So you described that for us, but we were just talking about facts as well, and evidence-based with the new administration. And it's good practice anyway, to always think through things from an evidence-based perspective if it's available. And we are, just a quick plug, we are going to be holding an Understanding the Evidence webinar very soon with the CDC, 2 CDC presenters. So that will be on the horizon if you want to learn more about how to understand and break down evidence. Talk to us, Shelley, about how you integrated evidence or frameworks or approaches, right? Evidence-based approaches to what happened after you gathered, you synthesized, and you shared the information.
Right. So after we gathered, synthesized, and shared, then we started to create, right?
Hey, yeah.
So then the creation for this idea of it actually, and I have to back up, because what we did after that sharing piece is that the group of coalitions, remember the 30, what we did is we got everyone together and we said, we need additional information. So I had gathered all of that and shared, and we'd synthesized and shared, but said, we need more, right? So those 30 coalitions went out and held community forums all across the state of Arizona, because maybe there was a part of the state that was missed in the information that we had all gathered and talked about and synthesized and everything. So we held 30 community forums from all across the state. And then we had an evaluator that synthesized all of that information. And then we created, right? So the top themes that came out. Now, when I did my individual process with those few people, I knew that we needed to increase education awareness. And it was confirmed by the community forums, all across the state. So the top priorities were to educate and inform people. Really didn't even know what fentanyl was. Counterfeit pills laced with fentanyl. They thought that the M30s on the street were, prescription drugs that were just, outside of the legal market. So really no clue. And then they had no idea that youth were buying these through social media apps and through text messaging. And then people were just really unaware about naloxone, what it was, how it should be used, how, when it should and shouldn't be used, the stigma around it. And so those were some of our key themes. And then, so we're like, okay, well, here are the main themes that came out of these community forums, because we always want to follow the data on our thread. It helps us inform. We want to follow what we're hearing from our community. So we're putting all of these pieces together, the personal stories, anecdotal stories that we're hearing. So we're putting this big, huge puzzle together. And so we said, okay, well, when we came down to creating, we divided into different subgroups. And at the heart of all of that, what we had to make sure was that we were creating something, because, and we did reach out. We asked our PHA to ask the CDC Foundation group. We asked our HIDTA prevention folks, that we reached out to them and said, does anyone have anything on counterfeit pills laced with fentanyl? And we did get a few pieces back. We got a piece back from Washington. And I think we got another piece back from another location, but there really wasn't much out there.
So items they had designed.
Right. Because after we had all this information, the last thing we want to do is try to reinvent the wheel, right? Because we went out there and searched, NIDA, SAMHSA, CDC, everywhere, to see what we could find on this from an evidence-based, research-based standpoint, because then we thought, well, we could just plug that in to our project here. But we searched and couldn't find anything. And so we said, okay, we do have to start from scratch here with the information that we have, but also we use the strategic prevention framework. So we're following the steps of the strategic prevention framework, which is assessment, right? It's capacity, So what our capacity is, our 30 coalitions, our planning, right? So we're planning what is it that we're going to utilize, what materials are going to be created and developed, and then we're going to implement and evaluate. So we're using that SPF model and framework. And then in that creation piece, what's always guiding that are those NIDA prevention principles that are found to be effective in reducing substance use. And if you go to the website, they're NIDA prevention principles, and it's been our guide the whole way through to say, okay, does this meet that standard, and is it following that principle? Because if it doesn't, you have to really consider, okay, why are we doing this, and how is it going to be? What impact will it make?
We're going to post those links to those two along with one other that Shelley may mention in just 1 second, so that you can pull them up now if you're interested in learning more about them.
Right. And so as we're putting the toolkit together, we're keeping those principles in mind so that we do have an evidence-informed and a research-based approach for this. So, and I'll tell you, it's ever evolving. Again, the toolkit's online now, but it's ever evolving because we learn different things. And so we're in that kind of a pilot stage, where if we need to readjust, we'll readjust.
So you created a fentanyl toolkit with those 3 guides, right, to inform your approach?
Right.
Okay. Let's dive into it, Shelley. Let's dive into it. So at this point, Shelley actually has it here. And while we move the camera closer to her so you can get a better view, just to share with you a little bit about this from start to finish, Shelley, this was 7 months in the making, correct?
Yes, this is my toolkit. Yes.
Okay.
It's been loved a lot. So, but this is the toolkit.
Tell us about it.
And I'll tell you too, Laura, the one thing that we didn't talk about is that, again, as we're working with the coalitions, we're incorporating the HIDTA, the 7 strategies, for success. So we're incorporating those 7 strategies in as we go through this process too. So just wanted to mention that. So the toolkit is broken down into 4 tabs. And the first tab is fentanyl.
You know what? Guys, we're going to post a link to this toolkit for you right now in the chat box so you could follow along.
Oh, okay. Yeah, that'd be great. Sure. You can go right to the website and follow along. So the first tab is fentanyl and counterfeit pills. And so you can go to the website. And then what you'll see there is you can click on toolkit and it'll take you right into the toolkit, and you can click on the first tab. And then, but just some of the items in the toolkit you'll see there's a PowerPoint presentation on fentanyl. Now, remember, when we were getting the feedback from our community partners, the problem was that there was a lack of understanding in terms of what fentanyl was, how were kids getting their hands on it, and then also addressing sort of what should a parent look for. We also talk about naloxone and the Good Samaritan law that Arizona has. And then also just helping parents understand that kids have easy access to these counterfeit pills laced with fentanyl right from the social media apps that they have on their phone. So there's a PowerPoint on there. So with each PowerPoint in the toolkit, there's a script that goes along with it. So it's so easy to use. You can pull up the PowerPoint, you can print the notes from the script, and you can do a PowerPoint presentation in your community. The other thing that I'd like to, share with you also is that you'll notice on a lot of our materials there's a lot of white space, and that is done on purpose because you can add your logo. You can add your logo, you can add your information, even though this is Arizona. If you're in, if you're in New Mexico and you'd like to add your New Mexico statistics or your New Mexico HIDTA logo, you can certainly do that. And we actually encourage you to do that because it makes it local and makes it, just fit your community better.
If they do that, the only language they need to absolutely keep on there, though, the funding source is.
The only language that you need to keep on there is a mandatory on all the materials. It just says this publication, is funded through a grant from SAMHSA. So that language has to stay on there. But the rest of it, you can, add your logo and put information on there. Like if you have a treatment website or something like that, you can add your treatment website and all those sorts of things. The other great pieces that we have on here are like fentanyl fact sheets. So for instance, this is a fentanyl fact sheet for young adults. And this fentanyl fact sheet, we have different sectors. So this fentanyl fact sheet is a front and a back page. And so you can print that. This is older adults. So one of the things you'll notice in this one is that the font's a lot bigger. So we actually worked with experts from older adult communities to make sure that the materials were easy to read and were in colors that were, easily to see with their eyes, with eyesight. So we did a lot to make sure that these materials would really have an impact on the groups that we were targeting. And also, you may have noticed on the back of this young adult piece, on this piece, this is directly from SAMHSA. So again, where we didn't need to create something new, we didn't. We used federal resources like CDC, SAMHSA, and HIDTA. And so the fact sheets are broken down for schools, behavioral health. Like for instance, in the schools, it talks about the action that a school resource officer can take, counselors can take, a school nurse, administration, that type of thing. So there are all sorts of different fact sheets in there for families, also for pediatricians. We did one specifically for pediatricians because pediatricians had no idea that kids under the age of 14 were getting their hands on these pills. And so, we talk, for instance, in the fact sheet, we ask pediatricians to consider this conversation, at least with the parents, talking with them about the prevalence of these pills and what's occurring. So there are fact sheets in there that we have. In addition, there are, and I will say that for the language that we use, so just so that you know, this wasn't something that we just came up with. So based on all of the research we did, based on our community forums, we sat down with he was called StoryBrand, a StoryBrand expert, to help us find the right words to put into our social media. Because, again, we know a lot about fentanyl, we know about naloxone because we all work in the field, but there are a lot of people that don't. Naloxone is so hard to spell, and fentanyl, it's hard to spell, and people are like, what? And there's legal and illegal fentanyl. And so we met with an expert to help us boil these concepts down into items that could connect with parents. And, Laura had mentioned that my heart's in primary prevention, which is preventing youth substance use. While this initiative is to help prevent youth overdoses and deaths and use, it's targeted to parents and caregivers. And the reason why is that, especially here in Arizona, maybe the same thing in your state, is that our kids are being asked to use substances at young ages, that we need our parents to understand the urgency of this issue and get in and talk with their kids about this. And we need all sectors of our community talking about this. So just want to talk a little bit about that and how the wording came about. So if anybody was interested to know, how did you formulate the words and the information, it's all, that's how we did it. And then we have things like postcards. So what we did with our community coalitions, we asked them, so what are some things that you use most in your community? And we made a whole list of things that they use in their community outreach efforts for like tabling events, or some coalitions would go door to door. And so we have a message on the front, and then there are 3 key messages on the back. And the key messages are basically talk with your children about never taking a pill not prescribed to them, monitoring their text and social media, and then getting the facts on fentanyl. And so we steer everybody to talknowaz.com. That's the website that we have and that we established. And again, you can put your own website on there if you'd like to create something like that. Now, here's the other great news. For all of our HIDTA friends and community out there that work with a Spanish-speaking population, 99% of the materials are in Spanish. If it's not in Spanish, it's just because we accidentally miss it. It's not omitted for any specific reason. So it's all in Spanish as well. So, and again, just different postcards that, again, community coalitions could use as tabling events. And then we have a door hanger that we were told that a lot of our communities, some of our communities in our Spanish-speaking population communities have promotores. So they do a lot of door-to-door education. So they wanted a door hanger. So we created a door hanger in both in English and Spanish. And so here's a great idea. So for the PHAs and the DIOs out there, or anybody that uses ODMAP, right? So ODMAP can tell you where your overdose is occurring, what days of the week your overdose is occurring, and even the hours. So if you know in your community that most overdoses happen, and this is because I just looked this up just the other day, in one of our communities, most of the overdoses were occurring on Sundays and Wednesdays. So I thought, wouldn't that be interesting if we had one of these like for naloxone, and we did door hanging on Saturdays and Tuesdays, before the spikes in the overdoses. So just things like that in terms of thinking and how we can coordinate some of the other terrific tools that HIDTA has and data that HIDTA has to like drive some of these prevention efforts. So I was thinking about that the other day, and I'm like, I'm going to go look, and I think we could do something like that using ODMAP. The other piece in that first tab is the social media piece, specifically on Snapchat. So again, parents are really, some parents are on Snapchat, but there are a lot of things about Snapchat that a lot of parents don't know. And so this has the counterfeit pill piece included in there. Again, there's a script that goes along with this, and there are handouts that go along with it too, in terms of knowing what your kids are doing online. So there are handouts that go, QR codes and hashtags and all that fancy stuff. And then we also include, because at the end of the presentation, so no matter what we're doing, if we're out in the community presenting to a community group or to parents, caregivers, foster parents, whoever it may be, we want them to take action, right? We just don't want them to come and just like you all here today, I'm hoping at the end of this that you're all thinking about something that you can do in your HIDTA community to take action, right? So thinking about, okay, what is this that I can take and that I can go do and implement? Because that's really important. That's why we're all here, is to take action. And so, for instance, on this one, we have contracts for internet usage and for cell phone contracts. Again, we didn't create these. These were already created online, and we just grabbed them and used them because they covered all the appropriate things. And so, there are take action items in there for people attending those presentations. And again, so moving into tab 2, which is on naloxone. And that's really, tab 1 and 2 are really sort of the meat of the toolkit and our most urgent needs right now. So moving into tab 2, which is on naloxone, again, I just want to point out that if we didn't need to recreate it, we didn't. This is a fact sheet from NIH on naloxone. That's a handout and can be used. So it's also available in English and Spanish. One of the things that was asked for by our coalitions was that there are some places that do naloxone leave behinds, or some areas that are, concerned about naloxone. Is this right for my community, or what is naloxone? And so on this sheet, and actually, where I got the idea for this? I got the idea from, many of you may know, Talk They Hear You, which is another great SAMHSA prevention parent-child conversation website. And so these are like little business cards. So these are just perforated. And so you can just punch out a business card and you just print those up. You can punch out the business card, and you can hand those out at events. You can use it in a naloxone leave behind kit. You can put them on the windshields of cars if you have permission. So all sorts of different things, that you can do with these different business cards. Again, it's just kind of remember, we incorporated the theme Save a Life. So, and just remember that, if your community would like a different image or something like that, these are just ideas. And if something would better represent your community, you can change it up to better represent your community. So I just wanted you to know that. And then there are billboards. So we have billboards that are along the same lines of those things. And then also our community coalitions are now starting to distribute naloxone for the first time. So, well, some of them have been doing it for quite a while, but some hadn't. And so our Department of Health Services offers naloxone. So we put in a naloxone ordering sheet. So that would be something, if your health department for your state allows that, you could put in the form for naloxone and show people how to utilize that. And then also we have, I don't want to forget. So in the toolkit, there is a PowerPoint presentation on naloxone, and it's just a real shorty. Because that one can be used if you have, let's say you're working with a group and they're distributing naloxone and they get 5 or 10 minutes with a parent or a caregiver or a significant other of someone, and you can just go through the PowerPoint with them and show them, this is what naloxone is. These are signs of an overdose. Always call 911. So that PowerPoint just walks you through what naloxone is, how to spot an overdose, how to use it, and then a little bit about the Good Samaritan law. So again, that can be used as short. You can use your phone to show it to someone who's coming in to pick up naloxone. And then also we have these cards on how to use naloxone. It's going to look a little bit different in the toolkit again, because it's always evolving. So it's going to be red. This one is kind of a cream colored, but it's going to be red in the toolkit, but it's how to use naloxone and then how to respond to an overdose. So we're giving these out with everyone that asks for naloxone in Arizona and as part of this initiative. So there are those cards. And actually, when we went and just presented this, the Department of Corrections was at the table, and they said, so we're doing these pre-release kits and we're including naloxone in the pre-release kits where people had an opioid use disorder. And so she said, boy, you just saved me a lot of work. So they're going to use the cards and they're going to insert that into the pre-release kits that go out to friends and families of those being released from DOC. So the last two sections are on youth resiliency and then also stigma. So we're still working on those pieces. We have things like PACS, good behavior game, in there as an evidence-based practice for youth and resilience. And so we have some other pieces in there, but we're working on developing that out more. We have a couple of, and again, CDC has some great stigma pieces. And so we have a few posters put together, kind of utilizing that theme from the CDC, but with some of our own photographs and images. And then we put together just a 2-sheet on cultural competence. Again, really important as we go out and we start talking to communities about this in terms of making sure that we're, culturally appropriate and sensitive no matter where we go and who we're talking to. So we have a little piece on that too. So that is the counterfeit pill toolkit, sort of in a nutshell. So I'm excited to share that with you.
Shelley, in our last 13 minutes together, let's go ahead and open this up for questions. And then we have just a couple announcements.
Okay.
And we want to get to the eagle.
Okay.
Patty, over to you.
Yeah, right now we have not had any come in through the chat. So that's probably a lot for folks to digest, and they're probably moving along, playing alongside on the website. So folks, feel free to just raise your hand and then you can unmute yourself and ask your own questions. So if you just want to raise your hand right now, if anyone has any questions. Or Laura, while folks are getting their questions generated and those hands raised, just to orient folks, if you scroll down to the bottom of your screen where your general functions for video control and mute are, you'll see a little button that says reactions. If you click on that button, you'll see an option to raise hand. So that's how you can go ahead and use that feature. And Laura, while folks are doing that, perhaps you want to transition to the eagle really quickly.
Well, we did want to just make an announcement. So, Shelley, I know that you just did a rapid orientation to the Fentanyl Toolkit, and it's just now coming online and available. So everyone can access it right now, can adapt it in a way that makes sense for them, right? Putting their logos on there. But also, I understand from you that you'd love feedback on it as well.
I would. From
our HIDTA community. So if you have specific feedback to share with Shelley, please do so. And this is how you can do it. You can send it one of two ways. You can send it directly to Shelley at, what's your email, Shelley?
So it's S and then M as in Mary, OWREY at azhida.org.
Okay. And Patty, if we could post that in the chat, that'd be great. But also, if you ever want to access anything that is coming through something that ADAPT delivers, all you have to do is email us at adapt@wb.hida.org. And Patty will also post that one as well. We monitor that 24/7, and so we can absolutely get you connected as well. Patty, while we're waiting, I'm just going to wait for you to give me the sign if there are any questions. But while we're waiting on that, another thing I wanted to mention was that this is the first of our conversations webinars. And we have multiple methods of disseminating information through ADAPT. We have social media, we have these webinars, we've got little things we call pearls, and just, our email distro. We've got a wide variety of methods that we can deliver information through. If you have something that your HIDTA is doing, if you think it warrants a conversations webinar, right? You'd love to share it with everyone through this particular modality, please email us. We are ready and willing to share the good news, the truth, right? Under the arch, right? What was that saying?
Be the bearer of truth.
Be the bearer of truth. So we are available for that. And if it's not a conversations webinar like this particular style, like I said, we could do a quick social media post. We can disseminate the link for you, anything that makes sense. All right, I'm going to continue to go on, Patty, until you interrupt me. There are two things that I really just wanted to highlight. Something that I think is really special. You know, I want to personally thank Dawn Mertz for allowing me to fly out here and even take up some of your time, Shelley. You know, I know that she is committed to prevention and has just been the biggest support for you. Can you talk a little bit about your support system and how you're able to achieve so much in what you do?
Yeah, I'll tell you, it has just been a true honor and a privilege to work for Dawn. She is an amazing leader. She believes in prevention 100%, and our entire investigative support center believes in prevention. I have the full support of our deputy director, Brett, and I'll tell you, Dawn's out there talking a lot about prevention. You know, she understands it. She leads the charge. Sometimes I think it's hard to kind of, because prevention is so hard to see sometimes. It's like if you work for a nonprofit and your nonprofit is building houses, you see dirt and then all of a sudden you see a house. Well, prevention, it takes a lot longer and you don't see the results for quite some time. But she really gets prevention. And, I just will tell you that I mean, she's wonderful to work with. And I couldn't do this job without the support of all of our HIDTA initiative commanders, are wonderful. And again, our ISC, our threat assessment team, because I call and bother them a lot. Our DIO and our PHA are terrific. And so, I mean, I just feel so fortunate here that we really it's a good team here. And I feel very fortunate that, we can go and we can talk to Dawn about any prevention idea. And let me just give you an example. I'm helping to lead this effort. And I didn't realize that for the last 6 months, 60% of my time was going to be spent on this, on top of all the other responsibilities that I have here at HIDTA. And so Dawn said, yeah, no, go ahead, do it. This is important. And so it was very kind to let me just, use the HIDTA time to, be able to put all this together. And because, so I can't do other things, so this is really important. So we pushed other things aside and here we go.
Well, and you're delivering this to your entire state.
Right.
You're not just limiting it to HIDTA communities.
Right. No,
well, you have several, right?
Yeah.
But this really is something that HIDTA, Arizona HIDTA, is doing for the state at large as well.
Mm-hmm.
Patty, if there aren't any questions, we're going to the Eagle.
No questions, but I did want, before we get to that Eagle,
okay,
we're building suspense. We posted a number of links in the chat today. And so what we'd like to do is send those out to folks after today. We have many of your email addresses. If we don't, for some reason, have your email address, we have sent you a direct message. So if you could check the chat box to see if you had a message coming in asking for your contact information, if you could please respond to that. That way, after today's event, we can give you a synthesized form worksheet that has all of this information on it. And off to the Eagle, Laura.
Drum roll. All right. So we've got this Eagle sitting back here. Shelley, pick that up.
Yeah. Well,
so pick this up. We, it's kind of funny. We were debating whether or not to even bring this. And at the end of the day, we decided 100% this represents kind of why we're here and having this conversation today. Before Shelley tells you about the Eagle, Shelley's special. She really has engaged a lot. We have a photo op happening right now. You're reliving it, right?
Yeah, that's right.
So she really has, dedicated your life to substance use prevention and is an expert, a true expert in this field. And we want to make her available. She is agreeable to consultation with any of you that, would really like to have a personal discussion with her or run some ideas by her. So if you would like to do that, if you could please email adapt@wb.hida.org and let us facilitate that for you. You are more than welcome to reach out to her personally as well, but we would love to track the engagement process. And Shelley and I have talked about a system for making this work, right? And to really facilitate engagement among all of us, because that's what we're trying to do here is really, collaborate and connect with each other and support each other in this field. This is a special eagle. Tell us about this.
Well, oh my gosh, I'm looking at the date and it's like 2015. I'm like, oh gosh, that was a long time ago. But it was the director at the time was Director Botticelli. And so if you remember back in 2015, 6 years ago, we were kind of in the throes of the, opioid epidemic, right? And so with prescription pills specifically. And so this was an award given for outstanding prevention effort. And again, this started as a HIDTA initiative on the Prescription Drug Misuse and Abuse Toolkit. That was a toolkit that was developed back in 2013. And so we did the same. We've sort of followed that same model that we're doing now in the fentanyl toolkit as well. But what we saw in this particular initiative, what we tracked were pills, turned in. But the other thing that we tracked were number of prescriptions prescribed. We tracked we tracked parents, we tracked kids, we tracked substance use. We went in some communities from 11% of our kids regularly using prescription pain relievers down to 1% in our most recent state survey. So, we saw dramatic decreases in youth prescription pill abuse, but we also saw a huge decrease in the number of opioid prescriptions and a number of doctors using and utilizing our prescription drug monitoring programs. So, so this was an award that was given way back when, and
by ONDCP.
By ONDCP,
right?
yeah, by ONDCP. So I was just wondering, I was like on the reaction, I was wondering if anybody knew what that was back there. So yeah, anyway, so we put that back there. Yeah.
Yeah, that was for outstanding prevention effort.
Yeah.
And you just mentioned some of the measures that you use to evaluate the effectiveness of that initiative. Can you talk through in the last 2 minutes what you're doing with the Fentanyl Toolkit, how you're evaluating the effectiveness of that? Because it's new, right? You said you're piloting.
It's new. So we're starting right now. Actually, it's fielded. A community view survey is going out through the 30 coalitions all across the state. So we're getting a baseline of where people's knowledge and attitudes and beliefs are about fentanyl right now. And then we'll do a follow-up after the campaign is over. And then we have a full host of evaluation tools for all of the PowerPoints, have a pre and a post. And then we're going to attempt the best we can to do follow-up with all of those families that attend those presentations and to get that information and measure that impact. We'll be taking a look at just some outputs in terms of, stories that appear or news coverage that happens or people that are attending. But we're really going to be looking at what is occurring in terms, and we're also going to be taking a look at naloxone and overdoses and trying to see where we are, because again, our summer months are coming up here, June, July, and August, and we need to see where we are compared to where we were last year. And we're hoping, it's tight, right? Because we're just launching this in June, and we know that maybe the lag effect is going to be a while, but we're going to get out there. We're hitting it hard. All of our coalitions are excited. And so we're going to be monitoring the overdoses. We're going to be monitoring, youth deaths and that sort of thing too. So we'll be looking at all those things pre and post.
So you're going to get a baseline first, then you're going to implement the toolkit, making it available, and then you're going to follow up.
Right.
Yeah.
Yeah.
Love it.
She's so good. She always puts my garble into a nice sentence.
Shelley, you are brilliant at what you do. This has been a lot of fun. I hope that all of you have enjoyed it as well. And please reach out if ADAPT or Shelley can support you in any kind of way. And we look forward to seeing you all in the next webinar. Thanks for joining us.
Bye, everybody. Thanks.